and what this does to your pelvic floor and what you can do to feel relief. So here's the thing. You're probably struggling. You might be struggling with rolling over, getting dressed, walking, standing up. It might feel like your pelvis is being pulled apart or stretched. Maybe it feels like you pulled your groin. Maybe your back pain just continues to get worse, especially by the end of the day. Your hip or your glute or your butt. All these different types of things are causing you pain and discomfort, and it's making it really challenging for you to get through your day, for you to get sleep at night. You might have been told that this is just normal. Buy a belly band, take Tylenol, use heat, all of those things, and nothing's helping. And you're like, how am I going to make it through X more weeks of pregnancy? This is terrible. I can't wait to be done. Wherever this is, this may be common. Very common, but this is not normal part of pregnancy. There's a huge disconnect between pelvic floor and what your pelvic floor can do during your pregnancy and how this supports not just your pregnancy, but your birth and your postpartum experience. So even if your provider has told you this is normal, it does not mean that something's wrong with your provider or that they're terrible or anything like that. Your provider does a really good job about keeping you and your baby safe throughout your pregnancy and your birth. But their job is a lot different than mine. Mine is to educate you on your pelvic floor, how to support you throughout your birth from the pelvic floor standpoint and recovery. And this is something that is lacking across the medical field, across just everything. There's so many misconceptions that surround your pelvic floor. It is not just do Kegels. Please stop doing that, okay? There's a lot of things that you can do to improve your pregnancy pain. And this is going to not only help your birth experience where you can like push less, tear less, so you have less to recover from. So you're recovering easier. And then also teaching you what you can do to help heal your pelvic floor and recover so that way you can feel like you again and not feel like something failed you or motherhood took anything from you, from your body or anything like that. Because so many moms message me and have these things. A lot of moms complain about like having the mom pooch or the mom shelf and like all of these different things, and it can all be helped with pelvic floor. And so my approach is teaching you what the heck your pelvic floor is, like the basics of your pelvic floor. It comes from like breathing, ditch your tight bras, find something that fits you a little bit better. It comes from teaching you how to engage your core, how to support your core the right way, because your pelvic floor makes up the bottom of your core, and your pelvic floor is currently supporting your bladder, bowel, and uterus. So as your baby gets bigger and it continues to grow, your pelvic floor has more responsibility. And if your core isn't working or connection with your pelvic floor, then there's even more responsibility on your pelvic floor, and this leads to pain and leaking. This leads to more difficult births because your pelvic floor has a hard time relaxing, and for a vaginal birth your pelvic floor has to relax and get out of the way. This doesn't mean that if you have a C-section you have no pelvic floor issues or no pelvic floor in anything. That's a major surgery, and we'll talk about that on another night or another day, but not right now. So that's the basics of learning your pelvic floors: how to breathe, how to connect with your core and your pelvic floor, teaching your glutes to work. If you're like, wow, I'm starting to lose my butt, or I've got this mom butt, or anything like that, or I'm having like this back pain or these hip pain or this like pain in my butt, and sometimes it goes down my legs, or every time I lay down at night my hips are burning. All of these things are connected and related. So by learning your pelvic floor and these basics, I teach you how to do your daily activities like standing up and rolling over, getting out of bed, getting dressed. So that way you have less pain when you do all of the things that you have to do all day long. And then I teach you a couple stretches or exercises to help support you with where you are at. This is a 3-step method I teach within the Ultimate Momma Bundle, because so many moms think I'll just make it X more weeks through my pregnancy and it's going to be fine after I give birth. But then you don't take care of yourself after birth because you're so busy taking care of this human, and you're like trying to get through the newborn stages and managing maybe multiple kids and all of the things, and it's not your fault. Like, it's hard, right? And so then a year, 2 years, maybe just a few months later, you're like, I'm still having this pain. I'm still peeing. I still feel weak. Like something still doesn't feel right. And it's all because we didn't address the problems during pregnancy. So they're still there. It's not just your pregnancy. It's not just like hormones and relaxing and things like that. It's this disconnect and this just inability to just lack of education and support in your pelvic floor. And it's not your fault. It's not your fault at all. It's that we just don't do a very good job about helping support moms throughout the pregnancy and birth and postpartum. And we just lead you to believe all these things are normal that aren't normal, and they can be helped, and it can have you feel better in your body, stronger, more comfortable, confident, all of those different things without having to wonder if I'm going to make it through the day. So if you have questions about any of these things, let's talk about them. Let's do a little Q&A. The Ultimate Momma Bundle right now until March 31st at 10 p.m. Eastern, you get a free one-on-one session, so we can sit down next week or this weekend and talk about what specifically you need to start doing so that way you can feel relief ASAP, as quickly as possible. With the Ultimate Momma Bundle, there's a find relief within 2 weeks guarantee. This isn't just pregnancy pain. This is your entire roadmap through pelvic floor roadmap through pregnancy, birth, postpartum. It's support every step of the way. It's not just programs that you're looking to complete. It's a program that we tailor to you and what you need. And I think every mom needs this support and this help throughout your pregnancy. I think that it's important for you to be able to feel good in your body, for you to have a birth that is exciting and that you are like, man, I did it. That was amazing. Like, where you were able to just feel so in control of things that you may not be able to control. And that's important too. Sometimes we're like, well, we can't really do much with our birth. We can't really plan it. So what's the point? But then when things don't go the way that you want or that you had hoped, it can feel a lot. It can feel like a lot physically, mentally, and emotionally. So by knowing what you can and can't do during that time when things don't go right with your birth and things change, it's important to be able to know that's okay. I got a plan. I got plan A, B, and C, and we're just going to roll with it. And these are the things that I want, and this is how it's going to happen. Anyways, going on a tangent about birth, but I think that's really important too, because there's a lot of birth, I don't want to say trauma, but trauma. There's a lot of birth trauma out there from the mental and emotional aspect of it too. And processing that birth experience is hard. And I've talked to a lot of moms recently about that. So I want you to be able to just feel your best and have the best experience possible, which is why the Ultimate Momma Bundle was created for you. And I want to add in a free one-on-one session so that way you can have the help you need right away. Like, I'm talking, we could meet tomorrow. We could meet on Saturday, Sunday, whatever you need. If you do it by March 31st at 10 p.m. Eastern, we'll hop on a call and we'll make sure that you are finding relief, you're feeling comfortable and confident, and you know the next steps for what you can start to do. If you have questions, concerns, things like that, let me know. I have a free guide that I just created too that I'm looking to get some feedback from moms. So if you are struggling with pubic, pelvic pain, message me, ask me for the guide, because I really want your feedback. I don't want to put it live yet. I want to make sure that things are good, but I might just pull the trigger and see how it goes. So I'm sending you so much love. It does not have to be like this. Your pregnancy, your birth, and your postpartum can all be improved by ignoring your pain now. It really challenges your postpartum experience. And it's not just 12 weeks postpartum. I'm talking about postpartum, like years after your kids are like walking on their own and being able to do their own things. How are you going to feel? Let's not put you off until that point. Let's take care of that now, so that way you can enjoy all those moments and you can be present and run around with them and go to the trampoline park and whatever it may be that you want to be able to do with your children without feeling like your body can't hang or keep up. Okay. Happy Thursday. Sending you love. The Ultimate Momma Bundle is linked on my page, or once this live is done, you can comment bundle below and it'll send you the link, and I will send you a free one-on-one to schedule with me.